You give us the vote?
Which one is it? Oh, there we are.
Oh, good.
Good evening. We are all together here for our third Board of Health meeting. It's March 3rd, and my name is Kim Hanton, and I am an advisor to the mayor for the city of Revere in regards to the health issues. And tonight we have a presentation on the coronavirus. We have Dr. Natalie Kong here to bring us up to date on all the most current information from the CDC and Mass Department of Public Health, as well as Dr. Joshua Vidala, who is from the school system, and he will update us on issues that are pressing within the school department. So I'm going to hand this over right now to Dr. Kong to start our evening.
Everyone. So I'm, as she said, Dr. Kong. I'm a primary care doctor at the MGH Revere Health Center and a member of the MGH faculty. So just to kind of get everyone up to speed with the coronavirus, the novel coronavirus, I'm referring to COVID-19. That's the name that the CDC has given it. Just to kind of, I'm going to go over some fundamentals. Hopefully this will take about 10 minutes and kind of bring everyone up to speed about what's going on. This all started a couple weeks ago in Wuhan, China. That's where the virus broke out, and they're thinking it's linked to maybe some like fresh fish or like food markets, and it has somehow evolved to infect people. From Wuhan, we have seen cases crop up in a number of countries around the globe. The biggest ones are obviously China, Japan, South Korea, Iran, and Italy. In addition to those countries having hotbeds of cases, we are seeing a growing number of cases in the United States. Most recently, Washington State has had a number of new cases crop up in the last few days or so. California, and Massachusetts, we do have one confirmed case in a male who had returned from Wuhan, right? So that's kind of an overview of what's been going on. We're still getting numbers every single day, literally every single minute of every day. The CDC and the Mass Department of Public Health both have fantastic websites that are constantly updating, and which is something that we are all constantly keeping track of so that we're aware of the numbers and kind of where we're at. That's kind of epidemiology, demographics. What is coronavirus? It is a virus, just like the flu virus, not too dissimilar from SARS or MERS. It is contagious, as you can see, a little bit more contagious than the flu, all right? The only difference is that we do not have a vaccine yet, unlike the flu vaccine, and we don't have a treatment for coronavirus yet, unlike the flu. We have Tamiflu for that. So the main things that the CDC and really globally what we're trying to do is to quarantine so that we stop the spread of infection, since there's no other way like a vaccine or a medicine to stop the spread of infection yet. There's research ongoing around the globe and definitely in the United States to develop a vaccine, but I don't think we're going to see it till next year at its earliest, all right? Quarantine, what do I mean by quarantine? So really anyone who's coming from these countries who have had these hotbeds of infection, the 5 that I mentioned, China, Japan, Italy, North Korea, Iran, those are kind of travelers that the United States Border Patrol are worried about, and they're, especially from China, the CDC and the government have already filtered these cases to specific airports so that they can be specially screened and quarantined if needed. The most concerning right now are folks coming from China. Those are the ones that are getting filtered to special airports, not Logan. Okay, they're not coming to Logan, which is the good news. They're going to other airports and getting filtered there, all right? All those other countries I mentioned, Italy, Korea, Japan, they're still coming here because they're not a high-risk category or as high risk as China for the CDC as of today. All right. When folks are coming back, or from those countries, or if they are exposed to someone that they know was definitely in one of those countries, we are asking folks to be very vigilant about their symptoms. If they develop a cough, a fever, or any difficulty breathing, we're asking folks to please stay at home and self-quarantine for 14 days. All right? The virus can't live any longer than 14 days. So if it hasn't already infected you, then it's not going to. It's already gone, or your body's already gotten rid of it. So 14 days is kind of the magic number. In addition to self-quarantining, definitely get in touch with your healthcare provider. Give them a call over the phone. We ask that you not go out into public areas, definitely not in a public waiting room of a medical facility where there could be other patients, young and old, or immunocompromised, all right? But give your doctor's office a call just to make sure that you don't need to be seen in an emergency room for further care, all right? They'll give you the green light and let you know if it's okay to self-quarantine. In addition to, and for those of us who don't have any of those symptoms, who otherwise feel well, what should you do? Hand hygiene is the number one thing we are recommending across the board. I mean, this is something we recommend for the flu anyway, and we are still in flu season. But hand hygiene, so that means warm water, warm soapy water for 20 seconds. I tell my patients to sing the alphabet when they're washing their hands, all right? So it's not just a quick, rinse under the water. You're really getting in there and scrubbing for a good 20 seconds. Try your best not to shake hands. Nick and I just did the elbow instead of shaking hands. Everyone knows about it. I hope no one's getting offended, but just try to limit your exposure to people and don't, touch your eyes or your mouth with your hands too much, okay? Try to minimize that as well. I know it's kind of hard to do, but these are the measures that you should all be taking if you're not in self-quarantine, or really even if you are in self-quarantine. All right. And then besides hand hygiene, Purell, if you can't hand hygiene, there are Purell dispensers, at every clinic, and hopefully they'll be restocked at CVS. I know it's out right now, but even if you don't have Purell, get yourself a sink and some soap, and that's all. Something I want to comment on are the face masks, all right? CDC is not advising to wear those in public. I think the issue is they don't want to give people a false sense of security. So if you're not feeling well, don't think that you can put a face mask on and go out about your normal business. You should definitely be self-quarantining. Okay, and we also don't want to give you a false sense of security and thinking that, I can go and do whatever I want. No one's going to get me sick. All right, those are really meant for healthcare workers to try and limit the spread of infection from patient to patient, room to room. They weren't studied, and they're not being, they weren't studied in the general population, and it's not something that we are recommending. Certainly not over just basic, good old-fashioned hand hygiene. Right? Am I missing anything? I think that's kind of the main things I wanted to get through from front to back on coronavirus. I mean, there's plenty more details I can go through, but I won't bore anyone. I think I'd rather open the floor to questions.
Well, what we'll do, Dr. Kong, is we'll allow Dr. Vidala to speak a little bit because there were some concerns regarding the schools, and we want to give him the opportunity. And then we need to be cognizant of time because we do have other agenda items for those of you that are only here to hear about the coronavirus.
And I'm also going to pass out some handouts I printed from the CDC to everyone, which summarizes.
Do that for you?
Yeah, sure. It just summarizes everything I mentioned, and it also has a website at the back of the 2-page one where you can get more information and constantly see those up-to-date numbers. Okay.
Thank you. So I will be brief. My name is Josh Vidala. I'm Assistant Superintendent of Schools. One of the reasons why they asked me to come today is Superintendent Kelly put out a statement. We did have a number of students who traveled on a school trip to Italy over the February vacation. There were some concerns because after they had visited Italy, there was an outbreak in northern Italy around Milan. Our students did not visit Milan. Before they arrived back, we did reach out to the CDC and the Massachusetts Department of Public Health. We also reached out to the Board of Health to get some guidance on what we should do with the children, because ultimately, the safety and well-being of all of our students is the utmost importance to us. So we did get guidance that there was a very low risk. We reviewed the itinerary of where the students traveled. We met with the students, and none of the students were exhibiting any symptoms, and the decision was made to readmit the students back into school. There was not a concern with any of the students re-enrolling or coming back to school after the trip. On that Wednesday, when they came back, we were fortunate enough to have a half day, which was an opportunity for some professional development. So Carol Donovan, the public health nurse, and I met with all of our school nurses because they are the medical experts in the building. And so as educators, we definitely don't make any decisions in isolation. We work with the experts in the area. We focus on the guidance, and we are continuing to, just follow the guidelines that they have around, safety, hand washing, and using, just proper sanitary technique. Been in touch with our custodians and our cleaning companies around cleaning the buildings and just practicing, good health and the guidelines that we're being followed. If anybody has any questions, we do have some resources on the website, as does the City of Revere. So that's what we're doing in the schools.
So for those that are not present here, we will have all the information that Dr. Kong just presented on, uploaded to the Board of Health website, so check it out. It's great information, it's great help. We can open it up for some questions. We have about 10 minutes, and then, as I said, we have to complete our agenda, and there are other items that are not related to the coronavirus. So if anybody has anything that they'd like to bring to our attention or ask about, we'd be more than happy.
Thank you, Doctor, for that presentation. And just a quick question. I know with the regular general flu, there's like a flu season. Obviously, this is a new virus, but do they anticipate that this will kind of fade away, that this could just, that there'll be like a season, so to speak, and within a few months, this will kind of all go away?
Yeah, that's a great question, and that is what some of the infectious disease doctors at MGH and Brigham are saying, that hopefully as the temperatures rise, similar to the flu, when the temperatures rise, the flu virus can no longer live or continue to be active. We're hoping to see the same thing with coronavirus. There's a reason flu season happens during the fall and the winter. It's because the temperatures drop, and we're hoping to see the same for coronavirus as well. Yep. Any other questions? We're all experts.
Well, we're still waiting upon the next agenda item, so.
We'll break that.
Does anybody?
Oh, we have another question.
We have another question.
Thank you all for having the meeting. I guess the next question would be is, what happens if it doesn't contract and it actually expands? Considering we're in a multimodal society, unlike China where they can actually quarantine like they did in Wuhan, you're seeing developments outside of Washington and San Francisco. You're seeing it not contract, and understanding that there's a time frame in which weather takes place and then it will eventually die out. What is the city going to do moving forward if for some unforeseen reason something does happen? The CDC is more of a reactionary body than a body that actually is precautious, considering at this point everybody in the hospital is, following droplet, airborne, and contact precautions with patients that are questionable. And that's also for the flu, but not to that degree. So I guess from what other people have been asking is, what happens if?
Yeah.
And I think it's a big if, but again, what happens if? Yeah.
It's a big if, but it's a very important if. I know at MGH we have a sort of like a disaster command center, and that's already been activated, and there are plans in place on many of the major teaching hospitals on what to do if the cases do increase. They already have a number of beds assigned to treat the cases of coronavirus that we are seeing. Because again, like many viruses, what you do is you basically help with symptom management. You kind of help shepherd the patient through. Part of what we're seeing too with the fact that it's not contracting in certain states could also be because the CDC has only started issuing more liberal testing guidelines, and we now have tests for it. So these patients could have been around all along, and now we're just counting them. So it's hard to know where we're at. Are we seeing true spread, or is it just it's always been there and now we're just counting them?
Able to check it.
Yeah, now we're able to track it. So we are still in a containment phase. It hasn't kind of reached a point where we're like, kind of giving up on containment and now just kind of trying to exactly mitigate. So that's good news, but there are plans in place at every hospital. And Carol, we actually last month just reviewed our own plan within the city of Revere, which has been in place for years and years and years, but we just kind of reviewed it together as a board to remind ourselves what to do and what are our sites for helping patients. I don't know if you want to comment a little bit further on that, Carol, but we do have a plan here in Revere, so let's see if we have another mic.
Okay. Hi, I'm Carol Donovan. I'm the Deputy Director of the Health Department. I've been working on the Medical Emergency Operations Plan since 2004, and this is a plan that allows us to be prepared to dispense vaccine or pills, if anything comes available from the state, to the community. And the plan is encompasses the whole community so that we have the capacity to do this. And we'd be working with everyone in the community to get it done. So that's been in place since 2004, since I started working on it.
If I could make a statement. Many people, I'm a city councilor, and Serino, and also my other colleague, Jerry Visconti, is here, but we fielded a ton of questions, and I want to thank you all for coming out and actually addressing this. I really appreciate it. I know Nick and Carol have been deeply involved with the dispensing issues that Carol had just spoken about, and I applaud you all for helping us in this measure, and more importantly, Dr. Vidala for, easing some of the parents' fears. A lot of people were very, very afraid, and I truly appreciate it. I'm sorry not as many people that had made their concern known did not show up, but hopefully Revere TV will forward this and people will have a better understanding. Thank you all again.
Thank you.
If I may, Jerry Visconti. Sorry, I came a little late, so I don't know if I missed the beginning of the meeting. My question mostly is to Dr. Vidala and probably the entire commission. I've been fielding some calls, obviously, about the concerns with the group of students and parents that went over to Italy, okay, and just came over. What was the thought process of not containing that group like some of the other districts have done? Because that's really what I've been getting is calls, and why haven't we done this, and why didn't we do this, and is there any reason, or what was the process?
Yeah, and that's a great question, Jerry. And I think the biggest difference that you see in Revere compared to some of the other communities that you're hearing about in the news that took different measures is the context is very different. So the location, the duration in which students were in Italy, and the location of where they were. I know that you've seen some other communities that maybe had taken a different measure. They did the same thing that we did. They reached out to CDC and they reached out to the Massachusetts Department of Public Health, and they got guidance. So with our students, where they visited, the duration where they were in, and the time frame in when they went was very different. So our guidance was very similar to some of the schools on the South Shore, like Milford and Hopedale, let their kids right back in. Other communities that maybe visited Milan or stayed longer, were maybe living with Italian families in different regions. Yeah. So that context being different, they got different guidance from the CDC. Okay. But we're all doing very similar things. We're reaching out to the medical experts, we're taking their guidance, and we're making informed decisions.
Well, that's great. I assumed that.
Absolutely, but it's good to ask the question so that people hear that answer.
Obviously, not doing anything, and obviously this public meeting is a great informative meeting for the residents, but you get calls saying, why aren't we doing that, or why aren't we taking those precautionary measures? And it's good to know that you guys are doing that behind the scenes. It's just good to know and explain that to the residents. So
Absolutely.
Thank you, I appreciate it.
And I appreciate you bringing that to light, and I would encourage people to contact the schools, contact the principal if they have questions. We're more than willing to sit down, meet with people, ease their concerns. Our nurses have all been trained. Our nurses are the medical professionals, and we're confident in the the guidance that we're getting, and we're working just like everybody else, you know? And
Thanks
so
again.
we're doing everything we can to keep the
Thank
kids
you.
safe.
Thank you.
Thank you.
Any other questions?
Maybe we have some questions within the group. I got one. So the virus itself, my question is, the virus itself about living on surfaces like doorknobs and counters and stuff like that, what is it, like 9 days? That's what I've been reading, yeah.
Estimating like a week to 9 days.
9 days, yes.
We're not, we're still, that's ongoing, that's information that's still being researched, because again, it's a novel coronavirus, but if it's behaving like other coronaviruses that we have seen before, about 7 to 9 to even 10 days.
Is that the same as the flu? The flu,
Very similar to the
Similar.
flu, yeah.
Yeah.
Two different types of viruses,
Yeah.
but
Yeah.
viruses nonetheless, so we're thinking that the behavior is not too dissimilar from the flu virus for sure.
okay. A lot of people bring up that question, you know. Anybody else? Questions?
I've been reading up on the coronavirus.
I think we all have. I think we all have, yeah. I think we all have.
In working with Dr. Collins.
What is the potency of this? Why is this different than what we faced before in the past viruses? Have you had any
Yeah,
insight?
well, I mean, so viruses are something that are, they're constantly evolving and changing. That is why the flu vaccine is something you have to get every year. Because every year the actual flu virus changes. There's also different types of it too. Every flu vaccine you get actually has 3 different types of flus in it, influenzas inside of it. And that's what the CDC is guessing are going to be the most dominant types based on all the decades and decades of research that we have around the flu, because it's been around for a long time. So like any other virus, it tends to evolve. So what they're thinking is, similar to avian flu, it probably came from an animal first, evolved to attack humans, and that's why it has shown up suddenly now. So hopefully we'll understand more about it, and hopefully if this is going to be a habit, we'll have a vaccine and even a treatment soon in the coming months or at the latest next year. All right, did I answer your question? Yes. Okay, cool. Something else to note too is that there are a lot of places, I know since I work at MGH, I get all the emails, so that's what I can comment on the most, but they're issuing travel bans. There aren't, per se travel bans, issued by the country, but at MGH, if you are going to come from any of those 5 countries, even though only coming from China, you're going to get, the Border Patrol will furlough you to Atlanta or one of those 11 airports. Even if you're going to Italy or Japan, MGH will force you into a 14-day quarantine. And now, why is 14 days such an important number? If the coronavirus has not taken hold of one of the cells in your body and started to multiply and cause an infection, it's not going to. It can't survive for more than 14 days. All right, so if these students don't exhibit symptoms in 14 days, they're clear. They're clear. So MGH is forcing employees, whether or not they interact with patients, they could just be working in a research lab, but whether or not they are interacting with patients, they are going to be forced to be under quarantine for 14 days. And then I know there's also a number of public events that are getting canceled across the country to mitigate and continue to contain the spread of this infection. So ongoing work. Yeah.
I have a quick
Yeah.
to you. Sorry, we're abusing you tonight. No, my question, and I know a lot of parents, a lot of people here, they're wondering, over the news, we all hear, like, I work at the airport, my other job, so I know if they come from an aircraft that's coming in from one of those places, all they do is like check the temperature. Mm-hmm. Is that a main symptom? Is that that's the first symptoms, or there is a way that it might be different things that, and we're not seeing it? Like what to expect? What is the first symptoms? We don't want somebody sneezing next to us, and when we jump the other side, we want to make sure that.
So again, the 3 main symptoms we're concerned about, in no particular order, are fever, cough, and difficulty breathing or shortness of breath. All right, so those are the 3 symptoms. You don't need all 3 of them. If you're just to be on the conservative side, if you're displaying even one of them, self-quarantine, okay? If you can, call out of work, don't go into the bus or the train or public places, and call your primary care doctor or other healthcare provider for assistance in whether or not you need to be further evaluated in the emergency room, or if it's okay for you to just stay home for about 2 weeks and make sure that your symptoms don't progress any further, all right? Or call us, or local public health department.
And Craig and Naza, can you introduce yourselves? Because the public needs to see the new faces of Board of Health.
Well, my name is Neza Louadi. I'm a resident of Revere. I represent the community. I've been living here for over 11 years. I'm very involved. I have 3 children here. I have 2 of them in high school, 1 at Romney. And I'm bilingual interpreter. I worked for early childhood services for several years, and now currently I work for an airline industry.
And I'm Dr. Craig Costanza. I am a dentist in Revere. I've lived here most of my life. I'm living here now with a practice and 2 sons and a wife.
And we can take a few minutes to, I know that Dr. Vidala needs to leave, and we actually have to move on to other agenda items. So for those that are here for the other agenda items, please stay. For those that are not, you're welcome to leave. You're welcome to stay. It's an open meeting. And I'm going to hand this over to our interim retired Director of the Board of Health, Nick.
Is it 6:30, 7:30, 7 o'clock? No.
Almost 7 o'clock.
Well, it was finally great meeting everybody. It's my first meeting the new board. I worked with the other board, and Kim was on the board many years. We went through various things, and I've been on health director since 20 years with the city, and the biggest thing we went through in the health department was H1N1, which we had to vaccinate every kid in the school system, which was an amazing thing. Carol was here with us. We had a great group of people. So the second part of the meeting tonight is we're doing a condemnation on, what's the number? 1510 North Shore Road, and I'm going to turn, is Peter here? Okay. So we're just going to hold up for a second. We're going to give Dr. Kong a little break. She's been talked out, So, yeah, she did a great job. Yeah. So we just wanted to have this meeting tonight to have an informational piece for the board, to the public, because everybody's calling everybody and worried about this and that and what we should do and shouldn't do. But I think most people have really read up on it and basically know what to do. It's similar symptoms to the flu, and sometimes, people might have it and it will just go away. But the people that are probably at the biggest risk are older people and people that, nursing homes and stuff like that. So I think out in the state of Washington, the 4 people who passed were in a nursing home. Is that correct? Yeah. And, it's every day it's, our health department's inundated with, and our staff, because we're working with people every single day. So it's really a trying experience even with our employees. So are they here yet, Cheryl? I'm sorry. Okay. So Cheryl, you want to just give a little update on what we're here for tonight? And I'm going to introduce, you can introduce yourself.
My name is Cheryl McCormick. I'm General Counsel for the Building and Health Department. Tonight around 7 o'clock, we're waiting for attorneys from D'Ambrosio Brown. We're going to have a condemnation hearing, and the board will decide after they hear all the facts presented whether the property should be condemned or not. And we're waiting for Attorney Peanut Brown to present, and he said he's on his way. So thanks for your patience.
But we can also let, because if this runs late, we can let the public know that August 4th will be our next board meeting. And at that point in time, we will have a presentation on vaping. So, April, isn't it? It's April. Did I say August? I'm so sorry. Sorry, public. Well, news broadcasting is not my specialty. So it's April 4th, and we will have Jonina from MGH and Bonnie from DPH. It's April 7th? Okay.
I'm not coming on Saturday.
Okay. All right. Sorry. No, we're not going to start over again. April 7th, so anybody, April 7th at, from 6:30 to 7:30, we will have a presentation on vaping. And I know that's another issue that's, pressing, and people are really interested. And hopefully we'll have some representation from the school as well, because it's really it's definitely a hot topic, so.
My daughter, she should.
Yeah. Yeah.
She's with the 84 movement.
So you're going to speak for us too? Welcome.
That's my daughter. She's with the 84, she's with the 84 movement for anti-vaping.
I know, yeah.
So Attorney Brown is on his way. It's Attorney Brown, correct? Okay. Is on his way in. Will he present first, Nick, and then we'll bring the parties up? Okay.
He's going to present the case for the city.
Okay. 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 Sounds good. Oh, there isn't?
No.
Okay. So it's just tenants?
Tenants.
Okay. So this is the first time that you guys have participated in, and we'll help you along. Absolutely. Absolutely.
See what she has. Natalie.
What's that?
See what she has. Marcia.
Marcia.
She got one.
Welcome, Marcia.
Thank you.
Is that Attorney Brown?
That's Attorney Brown.
Hi, Attorney Brown, we're waiting for you. That's okay.
You're prompt, actually. You want to grab?
You want to sit down there?
Sure.
Do you want to, if this has to be taped.
Tony coming? Tony coming? It's okay, we get started. Been a day.
Was your father the dentist also, your dad? I used to go to, on Newhall, yeah, for years and years. And he was my dentist, yeah, nice guy. Yeah. I don't think our teeth got so white.
Okay. Ready?
Yeah.
Okay. I apologize for being late.
Let's speak into the mic, Peter, please.
Sure.
Thank you, you're on TV, by the way.
So my name is Peter Brown. I represent the Inspectional Services Department, and on behalf of the Inspectional Services Department and your Director of Health, Nick Catanazzo, we are here together with the Fire Department to ask for your consideration and the entry of a finding pursuant to the State Sanitary Code and an order to vacate to the occupants at 1510 North Shore Road. My associate will be here shortly. I have copies for you of a number of things, but I'll kind of give you the background of this particular property, what I'm going to submit to you is a written memorandum that has everything that I'm going to go and describe to you. It has copies of orders going back several years in which the city has tried to deal with this difficult property, including a last inspection that occurred at the end of December 2019. It has orders, it has photographs, it also has all the documents evidencing the legal compliance with the strict process that brought us here today. This is not something that we do often. We have come to the board, I would say, about a half dozen times over the last 4 years or so. We reserve this kind of action for those really bad properties that we feel it can't really go on for any more days or weeks, and we're really jeopardizing the lives of the people who are currently in the property, as well as the properties and the people around it, including our public safety personnel, our police officers and firefighters, to the extent that they would have to go into this particular property. So the property we're talking about is 1510 North Shore Road. It is a multifamily property. It is it has 3 levels. And pretty much what's been happening for, over the last 5+ years is it's turned into an illegal rooming house, and it's just gotten worse and worse and worse. And they have created bedrooms which don't, out of closets, they've created bathrooms with illegal wiring and plumbing with light bulbs on top of a shower with exposed electrical. And we have bedrooms going out to points in the backyard with blocked access points where, God forbid, a fire starts, which is likely, given the illegal electrical issues, illegal installation of boilers and other heaters, that somebody is seriously going to get hurt, if not killed. And so in support of this application, you have Mr. Catanazzo is here, who could talk about this property, these types of properties. I also have an affidavit from Fire Lieutenant Erin Leary, who is in support of the action we are requesting today. So just briefly, we've had 4 inspections going back 6 years on this property. This property was previously owned by an elderly gentleman named Paul Beeman. He died in February of 2017. We had already been working on this property for 2 to 3 years before his death. He would go and pull some permits. He would kind of play his sensitivity with respect to his age to get some more time. And, we were hopeful that we could get resolution. That did not happen. He died in February 17. He died with no family, no spouse, no children. He had what we believe to be a companion named Ginny Schofield, potentially a companion. We do not know. But his bankruptcy case was dismissed following his death. His estate was then probated by this Miss Schofield. She became the appointed personal representative of the estate. That does not mean she inherits the property. It means she just became the legal representative for him because nobody else petitioned. She claimed to be kind of the companion living with Mr. Beeman, having some sort of relationship. We know from litigation records going to the bankruptcy court that there was a judgment from her against him for over $500,000 going back several years. So what the true story is, we don't know. What we do know is there was a big reverse mortgage on this property, which really means the equity of the property was kind of sucked out by this reverse mortgage. What happens is somebody passes away, then the bank comes in and effectively takes control over the property, and there's really not any money left. They really didn't know what to do after he passed away. It usually takes them a few years to get their act together, given the bank bureaucracies these days. Together with the bankruptcy, they've kind of just been sitting on the sidelines. So while they've been waiting between Miss Schofield or God knows who it is, people have come in and just taken control over this property. Our inspections have just shown people living at this property all throughout. Our interviews have shown that there's people charging rents, collecting rents, paying rents that have no connection whatsoever to Mr. Beeman at all. So this is just a property that I would kind of say has been lost to the streets. The major violations that we're concerned of, we have orders that delineate tons and tons of violations, but the ones that are the most serious and what brings us here is failure to properly install and maintain heating and electrical facilities in the numerous, not one, not two, not three, but numerous water heaters and boilers that have been installed without our electrical and plumbing inspectors' sign-offs and approvals, with exposed electrical wiring all throughout the property, including in illegally created bathrooms. The property lacks adequate fire protection system, and given their current use, there's no fire protection system that we can put in there that would safeguard this particular property. And it has the failure to maintain structural elements in that we have illegal basement apartment, numerous illegally constructed bathrooms and bedrooms, and an illegally constructed structure blocking and obstructing the rear means of egress in the property, which is a particular concern to the fire department. This, again, has been going on for several years. The notice of this hearing has been provided to counsel for the bank. They have not responded to us. This has been provided to all of the occupants of the property. It has been posted and strewn throughout. We have complied with each and every requirement of the sanitary code. We've gone over and above those requirements. So this is Anthony Brunco from my office. He has copies of all of these submissions for you. And with that, we have the memorandum. Nick and I are here to answer any questions that you may have. We have numerous exhibits. Exhibits E contain the photographs over the last two inspections in 2018 and 2019. Exhibit G is evidence of all of the notices that were required to go out. And we have affidavits from Attorney Brunco with respect to some of the things that I've been talking about, Mr. Beeman's death and the history of the property, as well as what we learned from the occupants. And we have the affidavit from Fire Lieutenant Leary as Exhibit F. I have a proposed order for the board that you could utilize to draft your decision. It's very similar in form, if not identical in form, to decisions that have been previously issued. So I have that available for your convenience. That could be provided either in electronic format, or I do have a paper copy as well. What will happen after this, if you were to go and issue the finding and issue the order, is Nick and I and Cheryl would then go and issue an order for the tenants to go and vacate. We would get a better idea of who's there, who needs some help, who needs push to get out of there. We will give them access and information with respect to resources of where they could go and people that could go and help. But this is a property where it's very important that no one continue to live there. Probably in our history here, we would give them another notice, and over the next week to 10 days, the property would be fully secured and no one would be occupying the property. It would also be placarded by the fire department.
Usually we board up the property.
We think there are dozens of people that we're going to be dealing with. In our individual inspections, there have been ranges of 5 to 15 people there, but in reality, there could be anywhere from 1 to 4 people living in a particular room that just weren't there on the various dates of inspection. We do know from some of the occupants that I've spoken to and that Cheryl has met with personally, and we put this in Attorney Brunco's affidavit, some people that have just been telling stories and got caught up in lies. So that doesn't mean that's all of them. In some of these situations where you've issued orders, we've had people who are innocently renting properties, didn't know better, and we helped them get resources, and we worked with CAPIC and other nonprofits, and then we had other people who know how to kind of play the game, and we're trying to take advantage. The pictures are Exhibit E. Sure. Yes. 17, yes. 14. Correct. This has been going on for now about 5.5 years. So we started this. We started this when Mr. Beeman was alive. It was actually one of the very first properties that we worked on when this task force was originally assembled. So we had the 14th, then we had again in May of 15. Then he had passed away in February of 17. 2 more inspections after that. And the last inspection was was at the end of December of 2019.
Peter, any since then, we've had any police activity at that property?
Not that I have documentation of, but we hear it is a regular problem over there.
So it was initially blocked by the fire department.
No, it was because of the
Renting of rooms and concern over fire safety.
about fire safety, smoke detectors.
Yeah.
Yeah.
Assuming that.
Yes.
The safety.
Yeah.
Yes. Yes. So the only time there was potential progress, which resulted actually in no progress, was Mr. Beeman illegally or in a non-compliant fashion with the law, to use better terminology, purported to do repairs at the property without pulling permits. And that had transpired either in the 2014, 2015 timeframe. We had given him an opportunity, as you would see, a disparity between May of 2015 and August of 2018. There were 2 things that occurred during that time. Number one is he claimed to have done the work, just did it without pulling the proper permits. So we gave him the opportunity to go and say, hire a licensed person, open up the walls, and if they will own the work that was done and attach their professional license to the work, we will inspect it, and if it's compliant, we will allow it to remain and sign off on it, provided it was done the right way and a professional will sign off on that. So we gave him the opportunity to do that, and it was not proper and legal work, and nobody would sign off on it. The second thing that transpired during that time frame is we had a tax foreclosure case because of tickets that had assumed on the property, and then that's why he filed for bankruptcy, and then he passed away. But what we put in the memorandum and our representation to you from our orders, from me and from Mr. Catanazzo, is that for each inspection since 2014 through December of 2019, the property has worsened each and every time.
Yeah, the problem is, that's called like an audit to collect. But there's nobody to correct other than the bank at this point. Yeah, so it'd be the bank, and you've contacted the bank.
Yeah, so the bank had disappeared and really disavowed this for quite some time. They popped back in about 4 months ago, where they sent their legal notices, and then they were going to go and do a foreclosure auction. We know there's a lot of interest in this property from a lot of the local developers. Our hope was that they would go and sell the property, not take it back, which is fairly customary at these bank foreclosure auctions, and then that new owner would work with us and fix up the property, and we would have a brighter and better future. Problem is that they scheduled the auction, and then they realize what they're dealing with, and they don't go through with it. So it's been postponed at least once before, I think twice. It's scheduled to go again next week, but the auction company and the lawyers aren't talking to us, so our expectation is that it is not going to go forward.
The bank paying the taxes at this point?
They did a few years ago. They are not now.
They're not.
So there's over $200,000 owed on this property as well. Tony, do you have the proposed orders, the proposed decisions?
Yes, they're in the back. Somebody want to speak on it?
Sure. So I'll give them the opportunity, absolutely.
Anybody here from 1510 North Shore Road that would like to speak, please approach the podium and state your name, please.
Tony, write down the name.
Name is Carlos Moran.
Can you spell your last name, sir?
Moran.
Thank you.
So I moved into the property 2015. Moved in with Mr. Beeman, helped him out as his personal caregiver, helped him out with his appointments, take him to a doctor and so forth. He had assigned my brother as property manager. He gave him a piece of paper, but he just signed it off. So that's the only thing we have available because we were helping him, fix the place. Well, not fix the place, like hire contractors, have them fix the place because he was planning on selling the home, evict people out, previous tenants that weren't paying him. And so once we got it, fixed, able to rent the places, he just unfortunately just passed away, and no one has really showed up or tried to take over. We know who has the will, but she just never.
Is that Miss Schofield?
Miss Schofield, I believe. Jeannie or Sylvia.
Yeah.
I don't know.
What's your brother's name?
Jose.
Moran.
Jose Luis Argueta.
Can you spell the last name?
Argueta.
Thank you. Is he still managing the property?
No, because he was only there when Paul Beeman was there. Once, he passed away, he didn't want to do anything with it.
What floor are you living on?
I'm on the first floor.
And is that in a particular unit or bedroom?
When I rented the spot for Mr. Beeman, he rented me a room. But right before he passed away, he just told me to since he knew I had brothers and stuff, just have them, move in, take care of the spot. Don't let it deteriorate or have stuff break.
Do you have the whole first floor?
Yes.
How many people are living on that first floor?
It's me, my brother, and one of my roommates. So 3.
What's your roommate's name?
Derek Sanchez.
Is anybody paying rent or collecting rent?
No, the only thing we pay is our bills, electricity, keep the place running.
I don't have any. Thank you for the information.
All right, my pleasure.
And I live on the second floor. Mackey, Mackey. And I kind of just wanted to address kind of what he said, is that no one ever came to claim this property. A few people had come, realtors came, put up signs, and we wanted to know more information. Okay, that's fine. If you're selling the house, just let us know, who owned it? Is there someone that we could pay rent to? We wanted to pay rent. We were there, I lived there as well when he was alive. And there was just no one to pay rent to. No one ever showed up. We thought maybe a bank, someone would show up and take this property, and nobody ever showed up. And then I do agree that there's a lot of problems with the place, but we also were living there. It's not like we just kind of moved everyone in. We were all there when he was alive. So I just wanted to just kind of piggyback on what he said, that no one came. It's not like we're there and we're fighting to want to stay. No one came to claim this property. And that's all.
Thank you. Ms. Mackey? Are there other people living at the property that have come in after Mr. Beeman passed away? Not your particular unit or floor, but all throughout the property?
Everyone that lives there now is everyone that I seen when he was alive.
And how many people would you say are living in the entire structure?
I think we're here.
Everybody?
We're there. I have my son's dad. They live on the 3rd floor. It's me, my son's dad, my son, and them. No, just us 4, not 4 on the 2nd floor.
And when was the last time you paid rent? And I understand nobody's come knocking, so I'm not giving any insinuation that you've done anything wrong.
Yeah.
But have you paid any rent since he passed away?
No. And that was the problem, is that we wanted to find, we wanted to know if there was someone that we should pay, then we should pay them. And a woman showed up Mrs. Schofield, whatever her name is.
Right.
And she wanted to collect rent, and we did refuse. And we said, until you show us proper document that our money is going to this house, we will not pay. And you can come back with a cop or whatever you want to do, come back with. And she had no proper documents saying that the house was hers, so we didn't pay her.
So how much were you paying before he passed?
I don't know. I didn't deal with I didn't pay him. I didn't pay him. I didn't deal with I didn't personally give him a check or anything.
So when was last?
My son's grandmother is the one that rented the apartment from the owner who passed away.
Name?
Her name is Miriam. Miriam.
What's Miriam's last name?
Molina.
Molina.
Mm-hmm.
Do you mind asking? How much were you paying rent to Mr. Beeman? 1,900. What? That was second floor, correct? Sure.
Is there someone who can translate from English to Spanish?
Yeah, I'll translate.
Yes.
Yeah, I can translate.
Yes? Okay. Buenas noches.
Do you have any questions that I can?
Oh, sorry. So what's your name?
Ramón Uribe.
Ramón
Uribe.
Uribe.
Sí.
Uribe.
So which floor do you live in?
¿Y qué piso vives?
Tercer piso.
Third floor.
And how many people live with you on the third floor?
¿Cuántas personas viven en el tercer piso?
Somos 6.
6 people.
Mi esposa, mis 2 hijastras, el sobrino de mi esposa y el primo de ella.
And when did you move into the property?
¿Y cuándo empezó a vivir allá en el tercer piso?
En mayo del 2016.
May of 2016.
Who rented you the place?
¿Y de quién alquiló el apartamento?
¿De quién?
Sí. ¿Quién?
No lo rentó José
Sí.
cuando eso estaba Paul vivo.
¿Quién?
Mr. Paul.
Oh, Paul. Beaman.
And what was the rent?
¿Y cuál era el valor de la renta? ¿Cuánto estaba pagando?
1,800.
1,800.
When was the last time you paid rent for the property?
¿Y cuándo fue la última vez que ha pagado?
Cuando nos llegó una notificación de la corte donde aparecía que la señora Jenny estaba administrando la propiedad, yo estuve llevando la renta a donde un abogado que ella había nombrado y le pagué hasta el día en que habían varias falencias, varios inconvenientes en la propiedad. La llamé muchas veces y le pasé por escrito al mismo abogado las falencias que teníamos y nunca me hicieron caso. Hasta ese momento le pagué.
Y no tiene la fecha.
Eso fue hasta noviembre del 2017.
November of 2017. I guess he was paying to a lawyer that was representing, what's her name? Jeannie?
Sure. You know who the lawyer was?
¿Y tiene el nombre del abogado?
Sí. Yo iba personalmente a la oficina de él, queda acá cerca.
He was going personally to his office.
Cheque. Debo buscar los extractos de mi banco para que aparezcan ahí.
Okay. So, Attorney Cottogio of Revere represented Ms. Schofield in the filing of the probate petition. So what this gentleman has provided is that Attorney Cottogio had sent a notice, what it looks like to be all of the apartments either, 1, 2, or 3 to the property, asking for any unpaid rents to be remitted to his office on her behalf. I could represent to this board that when it became clear after Ms. Schofield was appointed personal representative that there was no equity in the property given the reverse mortgage plus the substantial back taxes owed from the code that emanated in large part from the code violations at the property, she kind of abandoned this as well as abandoned her client relationship with Attorney Catosio. And that information comes from my communications with Attorney Catosio.
And what was the date?
This letter goes back to May of 2017. Was this the last time you had paid rent, sir? November. Okay.
En ese momento teníamos problemas grandes como el agua de la cocina, se nos reventó el tubo, le llamo a la señora para que ella fuera pues, a corregir los daños, nunca apareció, teníamos goteras en el techo, el guarajile mío se dañó, entonces tuve que asumir todos esos gastos y en ese momento dice, no voy a pagarle más porque no está haciendo, no nos está atendiendo como debe hacerlo.
So, yeah, the property has major issues, like the faucet in the kitchen is not working, the water heater is not working, which he had to replace himself. So he has had to spend money out of pocket for these expenses.
Sure. Let me, I'm going to say something in English and then ask if it can be relayed in Spanish to everybody. So, I'm an attorney for the Inspectional Services Department and the Fire Department that's requesting the board to take certain actions. I don't speak on behalf of the board. They'll deliberate and take whatever action they deem appropriate. But if they go and issue the orders that we have requested, then the next steps that the department will take is to have the property no longer be occupied. Right? Not looking to hurt anybody. So if before you leave, if you could either see my associate Tony or myself, I'd like to take down your information, telephone number, if you utilize emails, you give me as much information as you possibly can. We have access to social service agencies. We have access to places that can help with relocation assistance, find new places, and try and provide some help. It's not a guarantee that I can go and find you a new place to go, but we do like to try and help in these circumstances. So if you would like that kind of help in the event that the board does issue this order, which they may do or may not do, I think there's a better place to be than this particular property, regardless of what the board does. And I'd be happy to speak with you and share any resources or any help that I could provide.
So, básicamente lo que él dijo es que él es el abogado para la ciudad y que él quiere hacer, él está representando la ciudad y que él quiere hacer está proponiendo que esa casa esté desocupada, pero después puede hablar con el abogado, él quiere pegar la información de todos y ellos tienen cómo ayudar a encontrar otro lugar para ustedes. Un lugar que es mejor, es más seguro. Por la decisión es de ellos.
Y la pregunta es por qué motivo, sabiendo, es decir, se puede corregir lo que hay. Se puede corregir, no hay problema. Y es más, si la ciudad o el abogado deciden nombrar un manager, alguien que se haga cargo, nosotros a ese manager, a esa persona, pues iríamos a pagarle.
No es fácil para arreglar en este momento, porque estamos por 5 años. Es muy peligroso para ustedes y la gente. nosotros del pueblo tenemos una obligación para ayudarle a la gente, ayudar para otros que puede vivir en la casa. Y el board dijo, casa, puede ayudarle, no es seguro, voy a tratar, pero es la opción de ellos. Estás escuchando que dijo los abogados, todos los problemas, y él dijo, sí, estamos buscando que la gente salga en
10 días.
10 días.
10 días.
10 días. En mi opinión, hacer las cosas, el pueblo va a sacar, sale menos de 10 y del último, el fire department y todo para seguro la casa. Es muy peligroso. Sabe que usted tiene cocina en el baño con el techo, peligroso. Con eléctrico, dinero, con muchas cosas, muy peligroso para la gente vivir.
Y ustedes tienen la forma de ayudarlos para...
Y es que me dijo si usted manda su número de mucha información puede buscar para otra parte que hay mucha oportunidad, alguien puede ayudar. Nosotros no queremos poner a ustedes en la calle, es va a tratar de cualquier cosa.
Sí, porque todos somos familias. La familia del segundo piso, todos somos familia. Les agradeceríamos lo que puedan hacer por nosotros, por favor.
Lo que él dijo es que lo más importante es que no quiere poner ustedes en la calle, pero lo más importante es la seguridad y esa es una casa que hay muchos problemas,
Okay.
como con eléctrica, si hay un fuego, imagínense.
Para los vecinos.
Okay.
Y no pagar ningún peso. Que yo escuché, la gente, alguien está viviendo allá, sacando la plata de otras personas, no sé quién. No paga nadie, un peso.
Sure, I just think it would be appropriate if you could notify the board of anything that the gentleman said that they should hear.
So.
Not everything, you don't have to repeat everything that you said, but any testimony that he provided should be translated.
Just trying to see if there's any way like a management company could go in and help them to try to stay in the house, fix the house. But I explained to him that there's just too many life safety issues with electrical plumbing, and it's just dangerous for them to see that. It's not that we're looking that there are options if they give their information. Send 10 days. Help them. Advise them on money. Do some information I have received. There are people per room.
Yeah, it's pretty standard. 7.
The
problem is
because it rises to the level
Yeah.
of emergency situation that we're in now.
As
so
God
we don't
forbid,
want-
there's a fire in there, we know about the situation. Wrote up all the violations. This has been happening over a period of 5 years. And, we've given chance after chance, feel bad, but there is hope. Housing, Peter said, living under those conditions. So, then, beyond.
And I will say this, the accelerated deadline, while it requires us to run around and do a lot of work, it actually opens up resources that otherwise wouldn't be available because it qualifies as almost a super emergency type situation, and they jump all ahead of the list and they take us with that level of urgency. So if it's like a 30-day deadline, we don't see any real action until the last week anyway.
Yeah.
That sparks if you need that.
That's right. With respect to some of the resources that CAPIC utilizes in housing and families, it gives them what they need, your order. Yes, as well. That's exactly right.
Well, we had a similar property on Beach Street. Peter, and we worked on that. Same thing, 3-family, probably worse than this. Helped all those
I know that none of your problem, and you guys are nice home to go home to and everything, and I know
It
that
is
it,
our problem.
it is dangerous
It
for
is
us
our
to be
problem.
there.
That's why we.
But I have a son who's in school, like, I just don't think that 10 days, like, can you promise me to get me a place to stay in 10 days so that my son can go to school? Like, can we at least have 30 days? I just feel like that's more.
So, ma'am, this is what I could say to you, because I've been in this position before. Can I guarantee what you just asked for? I can't guarantee it. Have I pulled it off before with Mr. Cotanazzo and Ms. McCormick and some of the members of this board? Yes, I have. And you all have my best efforts to do everything I can to make sure that you have a roof and that your child stays in school.
And like, I'm in the middle of my semester, and like I said, I know this is not anyone's problem sitting here, or my personal issue, but I just think that 10 days is a little aggressive. I mean, we've been there for like
the 10
4
days
years.
is only because when it rises to this level and when it gets to hearing, as you can see, we don't take this lightly. We have an obligation as a city, as a whole, to make sure that our residents are safe. I appreciate and sympathize with you. Believe me when I tell you, we're not going home and just not listening and hearing what you're saying. I personally will be working with Attorney Brown and making sure that we do everything we possibly can. From the mayor down, nobody is looking to displace and put people out on the street. And we've been in this situation before, and if anyone can get it done, it's Attorney Brown. He's fantastic. So I can assure you we will do everything we possibly can. We hear you.
Please don't leave without providing your information. Yes. So the request on the city would be for the board to issue a finding that the property is dangerous, as defined by the sanitary code, to issue the finding requested by the Inspectional Services Department, as well as to issue an order of condemnation and to vacate. Well, sure, so that would be the motion that would be presented, and you would call for a vote.
Yeah.
You don't have to, you could report it. So the motion would be to issue the finding and issue the order. And those in favor of taking those actions would say yes. And if you are not in favor of taking that action, your vote would be no.
You want to talk about, we can vacate? Yeah. Yeah, okay, we can do that.
The board wants to meet now to talk amongst themselves, so we can come back in, after we give them a few minutes.
I think it's probably they have to deliberate.
We would just,
Able to go and carry forward the purpose of this order. It just means it would not happen within that 10-day period.
Sounds like that 10 days, it's everyone in this room, all the tenants have
Right.
have to wait, right? You have to wait to the displacement and provide safety to the displacement. And that's just a big, huge factor.
Or sitting on the street, no place to go. I've known you for a long time. I know that you're very honest to your word. You would help them. That's my biggest concern.
And no, and it's a fair concern. I will say this, in all the orders that have been issued, I've never been able, Nick and I, and Cheryl and Paul in the solicitor's office as well as the mayor's office, I never once had somebody that was displaced that communicated with us and was willing to accept help. And that includes situations where we did emergency condemnations without even coming to the board, where those orders issued within 24 to 36 hours. So never once in my, over 10 years of doing this for the city. If that were to happen, it's not because of the deadline, it's because the people we're trying to help were not willing to accept the help.
Can I just intervene? You got to speak into the mic, because it's a public hearing. People got to be able to hear what you're talking about.
My limited experience, and I know he's an expert on this, but I think I think with the 10 days really makes it an urgent matter for other options. I think the longer you extend this, the less urgent it becomes. I think if it's 10 days, it really puts us in a position to act that it's urgent rather than have it extended, then it doesn't become as urgent. I think it's more likely to get immediate help with the 10-day.
My experience has been the law, but I can tell you my experience has been the longer the deadline, the harder it has been to achieve the objective, what you're asking us to go and achieve, which is secure the property and get help.
Is 10 days enough time to get them help?
Yes. I'll be on my cell phone today, and there will be people taking my calls.
Just recently, we had, on a Friday, we had an emergency situation. And Friday, after City Hall closed at 12, Attorney Brown, by, 2 o'clock, 3 o'clock, had someone placed, and City Hall was closed.
Yeah. Peter, I've known you for a long time. I trust you.
I appreciate that.
There is a lot on the line with this, too. It's a tough decision all the way around. But I do trust, and I've seen him work, and he's been a patient of mine, a friend in the past. So I'm taking that into account.
And for what it's worth, all the things that you've come up, it does warrant like an emergency. So it's an urgent situation given all these violations. So
I think the thing you got to remember, this has been going on for 5 years. It's not something that just happened overnight. And these people are probably, back then, most of them didn't even live in the units. God knows who is living there.
And to clarify, 5 years, the property wasn't in this condition 5 years ago, because
No.
then why is an emergency now versus 5 years? It has progressively gotten worse, and it's progressively deteriorated to the point that it's now a life safety issue.
I think you're ready to vote now. Okay, so do I take a motion to condemn the property?
Yes.
Okay. So
Somebody needs to second it.
okay, so I guess I motion to do that, to condemn the property and give them 10 days to vacate. And exactly, and to accept Attorney Brown's findings. Anyone in favor?
I second that.
All in favor?
All in favor? Aye.
All in favor, aye.
Yeah. All righty. That's that.
The meeting's concluded for the board.
Can we just get on the record so that the 10 days will take effect? Just want to have a date for this, Peter, what the 10 days will be.
Monday the 16th.
Okay. And then, everyone, the board, and then the two board, everyone has to sign it. So it'll be March 16th, 2020.
One copy.
Do you need 3 originals or 1? Gotcha.
Finding right here.
In all the names, did you want those, or Cheryl was gonna say, okay?
Yeah,
Okay,
we'll-
thank you.
Sign those, yep.
So the plans are just for, the plans will be for everybody who's spoken today.
Peter, do you want a copy of this?
Yes.
Everyone's names?
I don't take a picture of this.
No, go right ahead. Actually, do you want to take that and just email it to me and I'll upload the file? Okay, so this convenes the meeting?
Yes.
Okay.
The meeting's
Meeting is
convened.
convened. Thank you all.